This is Randy, and this is part 2 of sex addiction-induced trauma in partners and spouses. Dimension 2, disclosure trauma. Disclosure trauma is a specific type of traumatic discovery incident and traumatic process, and may also occur many times in a partner's experience. Each disclosure is a critical trauma-inducing incident and traumatic process. A disclosure is the process of being told about some aspect of the deceptive, compartmentalized reality system, factual or not. There can be many disclosures, spontaneous or forced disclosures, and professionally guided disclosures, which is a clinical treatment process. All of these are conceptualized as trauma-inducing to the extent that ego-reality disturbance and fragmentation ensues as a direct response and symptom of reality incongruence that develops due to the critical intersection of original or pre-existing ego-reality with the sex-addicted, deceptive, compartmentalized reality system. The induction of fear into the psychological and relational system is one of the specific traumatic symptom processes of disclosure trauma in an SAIT context. And here SAIT stands for sex addiction-induced trauma. Disclosure can be one of extreme and sudden ego disintegration. For example, the car accident metaphor, or can be a subtle and slow evolution of or dissolve of ego structures. Quote, ink in the glass of water metaphor. The overwhelm to the ego from a single disclosure often induces the fragmentation of the ego dramatically, thus often causing severe and clinically significant symptoms, as first research via quantitative methodology indicates. Back in 2006, both dimensions 1 and 2, both discovery trauma and disclosure trauma, result in some form of ego disturbance, if not complete annihilation of a partner's reality ego, requiring clinical intervention and immediate stabilization, as indicated per rate of trauma resolution in the partner, not at the rate of the sex addict's demand or treatment demand. It is also important to understand the overlay of discovery trauma and disclosure trauma of the partner or spouse as a complex and nuanced traumatic process, often involving many experiences of acute trauma, Ptsd, and chronic and pervasive systems of trauma-inducing psychological and emotional abuse, and covert harm involved in the interrelationship between discovery and disclosure, dimensions 1 and 2, causing and relating to reality ego fragmentation. Dimension number 3 is reality ego fragmentation. Reality ego fragmentation is conceptualized as one of the critical injuries of sex addict-induced trauma. The dynamic interrelationship between reality and ego becomes traumatized and shatters, and the ego experiences turbulence toward eventual fragmentation. The SAITM understands the ego. That's the model. The SAIT model understands the ego as the organized conscious mediator between the psyche and reality, specifically the function in both the perception of and adaptation to reality. The ego and our ability to both perceive and adapt to reality adequately is essential for psychological health and stability. The greater the disparity between the perceived reality, which is the pre-existing ego reality, and the sex-addicted, deceptive, compartmentalized reality, often the greater the traumatic impact and consequence on the ego infrastructure. Reality ego that fragments from the intrusion of the sex-addicted, deceptive, compartmentalized sexual system often includes the most foundational structures on which many critical cognitive and psycho-emotional schemas and systems of functioning, including relational functioning, are necessarily dependent. Ego reality fragmentation then becomes one of the critical injuries of SAIT, and from this many SAIT symptoms and trauma-inducing dynamics evolve. And from this many The metaphor of the foundation of a house fragmenting slowly or suddenly or both applies in order to conceptualize ego destruction and damage. A traumatized, fragmented, and injured ego causes functional impairment similar to brain injury. The actual ability to utilize the ego toward initiating and effectively implementing health attempts becomes compromised and diminished. The ego seeks repair and integration by attempting to utilize itself to repair and adapt. Traumatic ego reality disillusion and fragments manifest as traumatic memories, body experiences, and traumatic coping patterns and intrusions seeking clinical metabolization and integration. Symptoms of ego fragmentation among partners and spouses often include alterations in consciousness, alterations in self-perception, amnesia or hyperamnesia, transient dissociative episodes, depersonalization, derealization, and reliving traumatic experience either through PTSD symptoms or through the process of ruminative preoccupation. According to the diagnostic system of CPTSD, alterations in self-perception include symptom clusters around a sense of helplessness or paralysis of initiative, shame, guilt, and self-blame, sense of defilement or stigma, sense of complete difference from others, utter aloneness, and sense that no one could understand, and a sense of a non-human identity. Ego fragmentation often results in significant traumatic loss cycles in which the survival coping reactions to the original impact and trauma creates a new set of feelings, reactions, and way one relates to self and others. This is like waking up one day and you are a different person, and this sudden different identity becomes a second fragmentation of ego reality trauma to original fragmentation trauma. These cycles of grief and loss from original self and ego reality due to trauma symptoms and manifestation of traumatized self as applied to partners impacted by sex addiction was developed and described by Sylvia Jason in 2009. That's new, folks. It is critical to note and link Dimension 11, the reality that the sudden loss of self and becoming someone different due to traumatic ego reality fragmentation is also traumatic for children within the mother-child bond attachment and dependency, causing ego disturbances and sudden shifts in children, family members, and any human being related intimately or in dependence to the partner or spouse impacted by sex addiction-induced trauma. Number 4, this is dimension 4. It's called impact to body and medical intersection. This dimension and symptom cluster focuses on SAIT and the body of the partner or spouse, physical impacts, medical concerns, and physical traumatic experiences. This involves the trauma to one's physical body, which can be significant for partners. This could include the impact on body image, triggering of eating disorders, weight loss or weight gain, vomiting, shaking, hair loss, sometimes extreme. I had that. Defecation, insomnia, and sleep disturbance, psycho-emotional dissociation, crying episodes, physical expressions of rage, hypervigilance, muscular constrictions, some stomach sickness, falling to the ground, fetal position, vaginal spasms, aversion to physical or sexual touch, sharp pains, uncontrollable primal screams, and screaming sounds. These are specifically some of the hundreds of physical and medical symptoms of trauma and SAIT among partners, as it is clear that psychosomatic traumatic manifestations are profound. Some partners may also be dealing with pre-existing medical concerns or physical health concerns, such as being pregnant or dealing with breast cancer and rounds of chemotherapy, when suddenly impacted by sex addiction-induced trauma. Due to the fact that some medical conditions are highly sensitive and relate directly to disturbances to the body associated with trauma, and SAIT, specifically nurses, medical, and healthcare professions, need to be educated on how to screen, assess, and treat sex addiction-induced trauma medically, particularly as it relates to other medical health concerns. In fact, even children who are in episodes of sex addiction-induced ego-reality fragmentation causing psychotic breaks and SAIT-related dissociation and trauma symptoms are being hospitalized, for example, and the medical team will often determine that no diagnostic or clinical explanations, when clearly SAIT pertains both in terms of diagnosis and in treatment. Gynecologists should be versed in sex addiction-induced trauma. The lack of recognition among medical professionals and the lack of intersection between people experiencing sex addiction-induced trauma symptoms and medical knowledge or insight is a serious problem. It is critical that the harmful impacts to a person's body is taken into treatment account and viewed as important in terms of clinical metabolization in the service of healing. It is also critical to develop integration of bodily impacts to an overall traumatic narrative and treatment process, for example, sexually transmitted disease and infections testing, which due to finances being used for the sex addicts treatment, the partner may need to use insurance only and also may encounter treatment harm based on gynecological insensitivity rooted in the lack of awareness in the physician of SAIT. Thank you, and stay tuned for part 3.